What's going on, world? Welcome, welcome, welcome. Hey, so today we are doing NCLEX questions, NCLEX questions, NCLEX questions. You already know how we do. I just left Nurse Amber's live. Some of y'all got the audacity to try to rush somebody who's giving y'all some free game. Y'all better chill. Y'all better chill out here, but you already know what we're doing today. We're doing NCLEX questions. We're doing NCLEX questions, which y'all know we are not going anywhere until I get 100 people in here and I get 1,000 likes. So today is Friday. You choose on what you want to do. You know what I'm saying? But if you guys are new here, welcome. My name is Kevin. I've been a nurse for 4.5 years. I'm a registered nurse. I've worked ICU, OR, and as well as PACU. So with that being said, I want to know who you are, where you're from, and where you are at in your nursing journey. But make sure you guys smash that like button, you guys share, and you guys follow. Man, it's taking a long time for y'all to get up in here. You know what I'm saying? So if you're new here, like I said, welcome, welcome, welcome. I want to know who you are, where you're from, where you're at in your nursing journey, as well as make sure you guys smash that like button, you guys share, and as well as you guys follow. If I don't got 100 people in here and I don't got 1,000 likes, we are not going anywhere. So what are we doing? Hey, how was everybody's week? How was everybody's week? Hopefully the week was good. Hopefully the week was good. What are we doing? What are we doing? I got 8 people up in here. Hey, make sure, if you guys are new here as well and you're in nursing school and you haven't shared this to like your cohort or anything like that, what are you doing? What are you doing with your life? So far, so good. Trying to get through the semester. Mary, I know that's right. Hey, you're going to get through the semester. Hey, we're already in March. So you know what that means? May is right around the corner. Just keep putting in that work and you're going to get there. I have spring break this week just studying. I know that's right. You know how they always say in nursing school, hey, guys, take a break. But they don't tell you. They're always want to not tell you, yeah, but you got to test when you come back, right? So you got to prepare for it. You got to prepare for it. Hey, if you guys are just now rolling in, we are about to do NCLEX questions. I am Nurse Kevin, or Nurse Daddy K, that some people have been calling me. I go by all shapes of names and I'm okay with that. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Happy Friday, Vaughn, to you. Graduate. Who is that? Jenny says I graduate in August. That's awesome. Take time for yourself. Meanwhile, I have exactly. So, hey, I need for you guys to like. I need for you guys to share. I need for you guys to follow. That is that's how the algorithm for TikTok works. Hey, we got to use it while we still got it. So I need 100 people in here. I need 1,000 likes. If y'all don't want that, then, if y'all don't want these like 50 questions that I have that we can go over, then I guess we don't got to go over them. You know what I'm saying? Get carpal tunnel for me. You know what I'm saying? I don't care what you got to do. Make it happen. But also, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse here, what are you doing? What are you doing here hanging out with us? Right? Just finished my prereqs for nursing school, medical field, last 12 years. Shout out to you, Brittany. Shout out to you. Thank you for the follow. Is it Pricks R Us? Nice name. Good for you. What else are we thinking? Shout out to all 145 of y'all. Hey, we need 1,000 likes. The faster I get to 1,000 likes, the faster y'all don't got to look at me in any of this. Shout out to Oregon. It says, thank you so much. I passed my NCLEX last Saturday. Shout out to you, Mary Ann. Congratulations. Welcome to the greatest shit show on earth known as being a nurse. If there's a piece of advice that you could give to everyone out here, what would it be? And of course, once again, congratulations to you. I start nursing school in August. Shout out to you, Tanya. Get ready because the shit show will begin as soon as you get there. All right. So be ready for it. But hey, you got it. Preparation, time management will get you there. Parker says, I just scheduled my NCLEX for Thursday. Shout out to you. Veteran in nursing school right now. That's what I'm talking about, Zach. Shout out to you. Hey, so we had 1,000 likes. So let's go ahead and turn this camera around so y'all can get y'all learn on. All right. Hey, you already know what we're doing. We're doing NCLEX questions. Do these every Monday, Wednesday, and Friday. And here we go. And question number 1. Nurse Channing is caring for 4 clients and is preparing to do his initial rounds. Which client should the nurse assess first? Is it A client with diabetes being discharged today, a 35-year-old male with tracheostomy and copious secretions, a teenager scheduled for physical therapy this morning, or is it a 78-year-old female client with pressure ulcers that needs dressing change? What are we thinking? Hey, shout out to all 200 plus of y'all. We are on the road to 10,000 likes. We're on the road to 10,000 likes. You know what I'm saying? We don't come here and take it without giving. So if I don't have 10,000 likes by the time I get to question 10, I'm pulling a Monique and my throat hurts. So I'm just letting y'all know. All right. Make sure you guys like, share, and follow the live because that is the trifecta that TikTok likes. We're going to use it while it's still here. All right. And if you're new here, I want to know who you are and where you're from and where you are at in your nursing journey. All right, here we go. Let's see what this answer is. Let us see what the answer is in 3, 2, and the answer is B, a 35-year-old male with tracheostomy and copious secretions. The patient with an airway problem should be given the highest priority. The ABCs identify the airway, breathing, and cardiovascular status of the patient as the highest of all priorities in that sequential order. Also, when it comes to highest priority, think about the level of consciousness, because if there's an airway, breathing, and circulation issue, the first thing that you would notice would be the patient's level of consciousness. So you always want to throw that in there as well. So shout out to everybody that got that question right. Kayla, ICU nurse, 6 years, just listening for old time's sake. Shout out to you, Kayla. I appreciate you. All right. Shout out to everybody that got that question right. And now here we go to the next one. I'm an LVN trying to get my RN BSN program. Shout out to you. Hey, here's the thing. If you're trying to get into an RN program and they don't have one in your area, and there's nothing wrong with going to another place to get your learn on. You know what I'm saying? There's nothing wrong with moving. Just letting you know. Here we go. Question number 2. Nurse Janice enters a room and finds a client lying on the floor. Which of the following actions should the nurse perform first? So what is the very first thing that you should do when you walk up on somebody in their room and they're face down? Do I want to call for help to get the client back in bed, establish whether the client is responsive, assist the client back to bed, or ask the client what happened? What are we thinking? Shout out to all 300 plus of y'all. We're out here rocking, doing some NCLEX questions. I want you guys to like, share, and follow. Hey, that's the trifecta. If you're in nursing school right now and you haven't shared it to people that you're in, cahoots or whatever that shit is called, I'm going to need for y'all to share. I don't care how you feel about them. I need them. Every one of them. All right, stop being greedy out here. I just came from Nurse Amber's, Nurse Glamber's live, and some of y'all got the audacity to rush somebody. When y'all are getting some free game, y'all better chill. Y'all better chill. You see what I'm saying? You got people out here that want to see y'all succeed. What's up, Marcy? How are you? Carpal tunnel for you? I love it. I love it. I love to see it. Amber, hey girl, I got you. I don't like people playing on my phone. You know what I'm saying? Y'all better chill when y'all getting this free game. When you got people out here that want to see y'all succeed, y'all better chill. But the answer is B, establish whether the client is responsive. You want to assess the client's current level of consciousness, right? I just said that. First, to determine whether the patient has had a loss of consciousness, then do the remaining choices if possible. The initial step is to evaluate the reactivity using objective measures. Address the patient verbally. Progress to light shaking, not shaken baby syndrome. Don't be shaking them like that, right? And then progress to more intense mechanical stimulation. So the first thing you do is, hey, Mima, can you hear me? Right? So Mima, are you there? So that's what don't call your patients Mima. You know what I'm saying? I'm just letting y'all know what's up. Just keeping it in a stack. So the answer is B. Shout out to everybody that got that question right. Hey, if you didn't get it right, circle back. Circle back. Emma, I said Mima, T. What are we talking about? Question number 3. Paige is a nurse preceptor who is working with a new nurse, Joyce, which is about to be a bunch of y'all. Hold on. Donnie just said, Kevin, thank you so much for your help. I passed my test yesterday. Everyone sign up for a 7-day course. I love to see it. Donnie, were you on who messaged me inside the community? Hey, I'm letting y'all know right now. Donnie messaged me this morning and let me know that they passed the NCLEX. So shout out to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to all 300 plus people in here that are rocking and trying to take that exam, what would it be? And once again, congratulations to you, Donnie. Congratulations. All right. So back to the question. She notes that Joyce is reluctant to delegate tasks to members of the care team. Paige, which is the preceptor, recognizes that this reluctance is most likely due to what? Is it role modeling behaviors of the preceptor, the philosophy of the new nurse's school of nursing, the orientation provided to the new nurse, or the lack of trust in the members of the healthcare team? What are we thinking? What are we thinking? Shout out to you, Donnie. Shout out to you. Donnie, hey, I still want you to go inside the community, and I really want you to go in there and share your wins, because I want everybody in there to know that you passed as well, because everybody needs to know the journey on how you got there. Don't hide your journey. Don't hide your journey, y'all. None of y'all. I don't care what y'all got going on. I don't care how many times you failed. I don't care if it's your first time. Don't hide your journey. All right. And the answer is D. Of course, it is the lack of trust in the members of the healthcare team. Lack of trust is the common reason for reluctance in the delegation of tasks. Some managers don't delegate because they feel they can work better than others. Since ultimate responsibility is of the delegator, they prefer doing the work themselves rather than getting it done through others. And that happens. that happens. It's not even, it can happen even in life. You guys ever had the time where you were like, oh, fuck it, I'll do it. That's because nobody can do it better than me, or somebody's not paying attention, or this, that, and the other. So it's the same exact concept when it comes to delegating a specific task to somebody else. My people that are going for RN, you guys got to recognize that. You have to recognize that. All right. Make sure that it fits their scope of practice, and as well as that they can do it. You have to trust your team in order to get things done, because you cannot do everything. All right. Question number 4, Nurse Paul is developing a care plan for a client after bariatric surgery for morbid obesity. That's kind of how I feel right now. The nurse should include which of the following on the care plan as the priority complication to prevent what? Is it pain, wound infection, depression, or thrombophlebitis? What are we thinking? Now, I need for you to read RTFQ. Who can tell me what RTFQ means? I'm an LPN and is wondering if there is a difference. There is. So if you're an LPN taking your LPN exam, the biggest difference that you need to understand is you need to know your scope of practice. So you need to know what you can and can't do, and what you can and cannot accept. Okay? You need to know what you can and cannot do, and what you can and cannot accept. Newsflash, LPNs, you learn the same content that an RN learns. Same exact content. So when you go to bridge to an RN program, you'll be like, oh, I know this. Yeah, of course you know it, because you've already seen it. Right? Got a bunch of people saying C and D. Is the test the same? The test relatively is the same, but it's about your scope of practice. As in, I'm an LVN taking care of 4 patients. Which patient is unstable that I need to report to the RN? So that's still a portion of delegation, if that makes sense. All right. But here we go. Here's our answer in 3, 2. And the answer is B. It is wound infection. Now, let's see why. Let's see why. This is why it's important that we read our rationales. Wound infection is the most common complication among obese clients who had undergone surgery. This is due to the poor blood supply in their adipose tissue. From a surgical standpoint, obesity is associated with a multitude of complications, including impairments of cutaneous wound healing, total wound failure, and fascial dehiscence. All right. These are all management of care questions, by the way, which is the largest section on the NCLEX exam at 18 to 21%. All right. Stable versus unstable, acute versus chronic, expected versus unexpected, right? I'm pretty sure all those sound familiar to you, right? As well as supervision, assignment, delegation, right? You sound like Johnny from Love is Blind. I wish I could tell you I've never seen Love is Blind, so I don't even know who that person is. Question number 5. A client presents to the emergency room with dyspnea, chest pain, and syncope. The nurse assessed the client and notes at the following assessment cues: pale, diaphoretic, blood pressure 90/60, and a respiratory rate of 33. The client is also anxious and fearing death, also known as a sense of impending doom. Which action should the nurse take first? So on a systematic approach, steps 1 through 4, what is step number 1? Walk through that door. Step 2, tell him. Oh, I'm sorry. I forgot where I was. Anyways, so what are we thinking? What are we thinking, y'all? O2. Okay. All right. O2. We got D. Airway first. Okay. ABCs. Y'all laughing at me? Hey, don't laugh at me. Everybody's telling me D. Got some B's in there. Okay. All right, Lissa. I see you. ABC rule. Okay. All right, y'all. Cool. Let's see what the answer is. Fluids. Okay, let's see what the answer is. Here we go in 3, 2. And the answer is A. Oh, it's not A, it's D. It's D. Administer oxygen via nasal cannula. The promotion of adequate oxygenation is the most vital to life and therefore should be given the highest priority by the nurse. When the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. As part of Maslow's hierarchy of needs, airway, breathing, and circulation, which are physiological elements that are needed for the body to survive and help determine one's level of health. So shout out to y'all. Hand me my degree. Hey, I mean, I got my degree back here. You want me to take my name off of it and give it to you? I don't know how that works. But hey, that degree coming to you. You know what I'm saying? Hey, speak that into existence and that degree will be yours. Trust and believe me. Shout out to everybody that got that right. If you didn't get it right, we'll circle back and make sure you guys check that out. But hey, real quick, I have some test taking tips, y'all. some test taking tips over there to help you guys conquer the NCLEX. You guys can check it out at my website, which is thebootnurse.com/test. 42 pages, y'all. 42 pages of test taking tips. Oh, and you get a fanny pack. I'm just playing. You don't get a fanny pack, but you do get to look at me in my fanny pack, which is glorious. So make sure y'all go over there and check that out. It's free. It's 42 pages of just knowledge for y'all. So y'all go over there and check that out. Who doesn't like free? Question number 6. Is it Nurse Pedro? Vote for Pedro. Receives a 11-month-old child with a fracture to the left femur on the pediatric unit. Which action is important for the nurse to take first? So what is the very first thing that we should do? How much for what? My fanny pack? I can't give you my fanny pack. Is it A, call for a social worker to meet with the family? B, check the child's blood pressure, pulse, respiration, and temperature? C, administer pain meds? Or D, speak with the parents about how the fracture occurred? What are we thinking? And remember, I know some of y'all are going to be like, this is too easy. Number 1, I didn't ask you if it was easy. Number 2, answer the damn question. All right. You want to know why? It's because if you go and take NCLEX, they have like a question bank of like 10,000 questions. Some that you'll never ever see. You see what I'm saying? So you have no idea what's going to be on the NCLEX. So answer the question. Nurse Kevin is spicy. Hey, look, don't come. Hey, Jenny, don't come for me. All right. I will listen. All right. I ain't about the games. And plus I had a Celsius. Y'all know those got cocaine in them. Boy, let me tell you, I'm feeling it right now. Anyways, here we go. And the answer is D. Speak with the parents about how the fracture occurred. Let's see. In cases of injury, especially among children, it's very important that the nurse should first assess possible abuse. Right? Hey, look. This is why we read the rationale. Abuse is one of the reporting responsibilities of the nurse. The first step in child protection response system is the identification of possible incidences of child mistreatment. Personal or medical personnel, educators, child providers, or child care providers, mental health professionals, law enforcement professionals, the clergy, and other professionals are often in the position to observe and or screen families and children to identify abuse or neglect when it occurs, right? So it says maybe I need to switch. Hey, I'm letting you know this Celsius got me hyped right now. It's crazy. All right. So this is where they're asking about the fracture, right? They're asking about like how does this baby, this child, get a fracture? They're the only, so essentially like if you walked up on somebody and they had a humerus fracture, that's a child, there's no way that a child can just get a humerus fracture or a femoral fracture. Does that make sense? They're asking what is the most important. All right. So make sure you guys go through your questionnaire. Hold on. Make sure it says your live may maintain themes not suitable for young. What? Hey, so I just got something from saying that my live wasn't suitable. Hold on 1 second. I understand the decision, but the restriction is too strict. The notice is unclear. My live doesn't contain. There you go. Like, what are they talking about? Hey, so I don't know what y'all did, or somebody said something about whatever. Maybe it's something I said. Maybe I can't say cocaine no more. I don't know. Maybe somebody reported me because I cussed them out. Sorry if I hurt your feelings. Anyways, I'm not. Question number 7. Nurse Sky is assigned to the cardiac unit caring for 4 clients. He is preparing to do initial rounds. Which client should the nurse assess first? All right. I think it was my statement about about the Celsius. And that's okay. Is it a client scheduled for cardiac ultrasound this morning, a client with syncope being discharged today, a client with chronic bronchitis on nasal oxygen, or a client with diabetic foot ulcers that needs a dressing change? What are we thinking? Man, TikTok really ain't playing no games. I just had like 600 people in here and it cut it down to like 190. That's crazy. Y'all keep sharing. Hey, remember, like I said, hey, I need 10,000 likes or my throat gonna start hurting. No cap. I think that's what the kids say nowadays. Hey, if you guys are don't be sorry. It's all good. This is why I do stuff off of TikTok and all other stuff too. So I'm not really worried about it. TikTok be tripping lately. I think TikTok is just, really tripping for the fact that they're just like, oh, America, y'all want to cancel us? Fine. I'm gonna just cancel creators. All right. We got D's, we got some C's, we got some A's. Okay. All right, we're kind of all over the place. Hey, if you guys are just now joining, well, they are in their feelings. If you guys are just now joining, we're doing NCLEX questions. I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys like, share, and follow the stream. That's a trifecta when TikTok ain't tripping to put it in front of the For You page. All right, so make sure you guys go over there and do that. But the answer is C, a client with chronic bronchitis on nasal oxygen, right? So a client with airway problems should be attended first. When the nurse needs to prioritize patients, we talk about Maslow's hierarchy of needs. We talk about airway, breathing, circulation, right? Observing ABCs is a rapid assessment of life-threatening conditions in order of priority. So shout out to everybody that got that question correct. Some of these, hey, so here's the thing about nurseslabs.com. Some of them, they're just weird. Like they don't make any sense. This one, I don't know what it is. Shout out, hey, I appreciate whoever just gave me y'all hit me the target goal, so I appreciate y'all. But you got to take them with a grain of salt, right? And this is why I always say that you guys have to go back and you guys have to look at the content, even if you got it wrong. If I could go through 100 questions, right? I could go through 100 questions. 10 of them aren't going to make any sense, but it still doesn't give you the right to just not do well on an exam, if that makes sense. All right. It is being weird today. It is being very weird. Right, so here we go. Question number 8. The nurse enters a room and finds a patient lying face down on the floor, bleeding from a gash in the head. The nurse's first action should perform, or what action should the nurse perform first? Is it determine the level of consciousness, push the call for help, turn the patient face up to assess, or go into the hall to get the nursing assistant to stay with the client while the nurse calls for the physician? What are we thinking? This kind of looks familiar. Right? So shout out to all y'all out here. Rock. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. TikTok has really just killed my vibe, man. It killed my vibe. Killed it. But what are we thinking, y'all? What are we thinking? And if you're not a nurse, what are you doing here? Rocking with us, getting your learn on. You from Philly? Is it Sharonda? Did I say that right? Sharonda? Philly, I graduated in May. I feel like it could be C, though. I don't know. I'm stuck on this one. Hey, Stephanie, it's okay. I would rather you guess. You have a 25% chance of getting it right than not getting it right at all by not even choosing, if that makes sense. All right. A, okay. Shout out to Arkansas. You graduate in August. Okay. Chicago, take your PN in 3 weeks. Shout out to Louisiana. Latrice, is it Guyana? Shout out to Guyana. You graduate in April. Study grind. I know that's right. Shout out to Bama. Hey, Miss Cece, Nurse Cece. Hey, if y'all ever need dosage calculation, y'all go holler at my girl, a blessed RN. She will get you dosage calculation right. Trust me, I'll be sitting there watching her. I'm just like, First of all, where were you when I was in nursing school, ma'am? So shout out to her. If y'all ever need to get their dosage calculations on for any reason, y'all go holler at her. As a matter of fact, let me see. Hey, Cece, there you go, right there. I'm a pinner, so you guys, if it'll let me do it. Oh man, it won't let me do it. Boo. Hold on. TikTok is being weird. All right, anyways, but the answer is D, determine the level of consciousness. Assess the level of consciousness should be the first action when determining the client that might have fallen over. The initial step is to evaluate the reactivity using objective measures, address the client or the patient verbally, progress like shaking, and progress to more intense mechanical stimulation, right? So, yeah, there she is. Hold on, I'm trying to pin you, but I don't think it'll let me. Yeah, it won't let me do it. So, at Blessed RN, there she is right there. I'm telling you, that lady right there will get you right. She will get you right when it comes to dosage calculation. So, shout out to everybody that got that question right. All right, here we go. Question number 9. Ooh, yeah, here we go. Question number 9. Nurse Adane is working on the night shift with a nursing assistant. The nursing assistant comes to the nurse stating that the other nurse working on the unit is not assessing a client with abdominal pain despite multiple requests. Which of the following actions by the nurse is best? Ask the other nurse if she needs help. Assess the client and let the other nurse know what should be done. Ask the client if he is satisfied with his care, or contact the nursing supervisor to address the situation. What are we thinking? Cindy, you are welcome. CC, I got you. Hey, people like, who is it? Like Nurse Sugar, who I just started following, Nurse Glamber or Nurse Amber, another NCLEX strategist, as well as a Blessed RN, Nurse CC, and who else? Nurse Larissa. You know, we out here, as Amber says, we're out here in these TikTok streets trying to get y'all right. That's what we're trying to do. So if y'all ain't following none of them, y'all make sure y'all go follow them. Larissa, hey, that's the one that'll get you right. Like, I'm trying. I might take some real estate classes from that lady over there. Like, a blessed RN. There you go. It's a blessed RN. She's my mentor. Hey, she's great. I love Larissa. She's awesome. Thanks for always looking out for. That's what. We got to do what we got to do for each other. You know what I'm saying? Who's gonna teach you other than us? You see what I'm saying? That's how you do it. Even if I get through to one of y'all, that's all that matters. Is like, at least I got through to one. Do I want to get through to all of y'all? Absolutely. But here we go. The answer is D. Contact the nurse and supervisor to address the situation. The nurse should use a proper channel of communication. The nurse supervisor is responsible for the actions of the different members of the nursing team. Assessment and treatment of pain is often complex. The standard definition of pain is whatever the experiencing person says it is. Whenever the experienced person says it does. Oh my goodness. Obviously I can't talk. Anyways, so if somebody's doing something that they're not supposed to be doing, you take it up to the nurse supervisor. You use the proper chain of command. All right. Use the proper chain of command. McAfee, they're citing something. I don't know exactly what they're citing. Like I said, these are off of nurseslabs.com. They help. It says, no way, I ain't no snitch. Hey, let me tell you something right now. When it comes to your license, best believe that ass is snitching. Stop playing games with me. You already know you snitching. Trust and believe. I love when people are just like, I ain't snitching. Next thing you know, y'all sitting in court like Tekashi 6ix9ine saying like, Your Honor, I definitely can tell you about what Treyway stands for. Okay, stop playing with me. Snitches get stitches. Hey, I'm just letting y'all know. Hey, who said it best? Bernie Mac, I ain't scared of you motherfuckers, right? R.I.P. to him, right? Here we go. Question number 10. Nurse Vivian is reviewing immunizations with the caregiver of a 72-year-old client with a history of cardiovascular disease. The caregiver learns which immunization is a priority for this client, right? Is it Hep A vaccine, Lyme disease vaccine, Hep B, or is it pneumococcal? Me in court, rat. That's what I'm talking about. Hey, everybody says I'm not a snitch until that piece of paper that says you versus the United States of America. You be like, shit, how I piss off 350 million people? Well, start singing like a canary. Shout out to all 141 of y'all out here rocking with me. We're doing NCLEX questions off of nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check those out for yourself. Now, I will agree with Nurse Amber. These are really good to, try to get an understanding or a basis, but I will always be one to recommend getting a QBank from somewhere. So Archer, UWorld, so on and so forth. Those are also definitely good ones to check it out. Mariah, I know that's right. I should be listening to my diabetic lecture. Stephanie, you should definitely be listening to that lecture. But the answer is B, pneumococcal vaccine. Pneumococcal vaccine is a priority immunization amongst the elderly, especially those with chronic illnesses. It is administered every 5 years. A pneumococcal vaccine is indicated in the United States for all adults 65 years or older, as well as younger patients with conditions that increase risk for developing pneumococcal pneumonia or invasive pneumococcal disease. All right. Once again, all these are part of management of care, which is 18 to 21% on your NCLEX exam. And if you're an LPN taking your exam, it is known as coordinated care. So same thing, just named different. All right. So shout out to everybody that got that right. Ladies and gentlemen, I have a book out. I have a book that you can pre-order. It's called Conquering It. Or Conquer It, which is the journey to passing NCLEX. Why? Y'all, I failed my NCLEX 3 times. I failed it 3 times. Not once, not twice, 3 times. Shocker, right? See what I did there? Anyways, I failed my NCLEX 3 times. Let me tell you something right now. Don't nobody care. Don't nobody care about anything that I had going on. Don't nobody care about what y'all got going on. Don't nobody care. Your job will never ask you. Your patient will never ask you how many times you took this exam. You got to get out of your own way. You got to get out of your own way. You got to put in the work, right? You got to look at that CPR to see why you failed. You got to get over your own anxiety. You got to practice to the test. Create an environment in order for you to do better. You see what I'm saying? No one will ever care. And if you ever hear somebody that tells you that you should never be a nurse because you failed an exam, you can kindly tell them to go fuck themselves, right? Respectfully. I don't know how you respectfully say that, but figure out how to say it. Because no one has ever walked a day in your shoes at all, period. All right. So get out of your own way. And this book right here is not a run of the mill. It's a little bit different. right? So it talks about, hey, my journey and the things that I did differently. All right. So make sure you guys go check that out. It's thebootnurse.com/books, and you guys can pre-order it. It comes out June 5th, which is my 4-year anniversary. All right. 4-year anniversary of becoming a nurse. C's get degrees. I know that's right. Here we go. Question number 11. You are admitting a patient for whom a diagnosis of pulmonary embolism must be ruled out. The patient's history and assessment reveals all of these findings, which finding supports the diagnosis of a pulmonary embolism. Now, let's think about it. What is a pulmonary embolism? All right. What is an embolus? What is pulmonary? What is a pulmonary embolus? All right. So think about that. The patient was recently in a motor vehicle accident. A patient participates in an aerobic exercise program for 6 months. The patient gave birth to her youngest child 1 year ago, or the patient was on bed rest for 6 hours after a diagnostic procedure. What are we thinking? Now, think about it. How and what is a pulmonary embolism? Pulmonary meaning lung, right? Embolus meaning like some type of a clot, right? Moving through my vessels, right? So think about that. How can clots get into my vessels? What can happen? Everybody's telling me D, everybody's telling me A. The NCLEX wants you to critically think. You have to be able to critically think in order for you to make a clinical judgment. Inflammatory response to the accident. Okay, Kim, I see you. Smarty pants, I see you out there. All right, you got to be able to critically think. So how is a pulmonary embolism caused out of the 4 answer choices, right? And then what is it? What can I determine what causes that? All right, here we go. Here's our answer in 3, 2, and the answer is A. The patient was recently in a motor vehicle accident, right? Patients who have recently experienced trauma are at risk for deep vein thrombosis and pulmonary embolism. PE remains relatively common after trauma and occurs in the absence of lower extremity or spinal fractures. Although PE is usually thought to occur between day 5 and 7 after injury, data suggests that as many as 37% of pulmonary emboli occur earlier. So you got to pay very close attention when you're in a motor vehicle accident, because there could be injuries that you can't see, or if there's injuries that they do sustain, what you need to watch out for, such as if they have a fracture or if they have internal bleeding, right? Guess what? If those clots that from the internal bleeding end up inside those vessels, they got to go somewhere. They have to go somewhere, and they're going to end up in the lungs, right? And we don't want that. And I'm telling you right now, the moment that you see ever in your life somebody, throw a PE. That's what we see. They're going to get as white as the back of this damn PowerPoint, and you'll never forget it. You'll never, ever forget it. And it's the craziest shit you'll ever see in your entire nursing career. You're like, wow, I don't ever want to see that again, right? Here we go. Question number 12. You are assigned to provide nursing care for a patient receiving mechanical ventilation. All right. So somebody's on the vent. All right. Which action should you delegate to an experienced nursing assistant? Now, what can a nursing assistant do? Right? Know what their scope of practice is. Now, can a nursing assistant assess the patient's respiratory rate every 4 hours? Can a nursing assistant take vital signs and pulse oximetry readings every 4 hours? Can they check the ventilator settings to make sure that they are prescribed? Or can they observe whether the patient's tube needs suctioned every 2 hours? Anytime you have a question like that, that's how you should read it. Oh, a nursing assistant, an LPN. Oh, can a nursing assistant do whatever the answer choice is asking? Okay, so what are we thinking? Hey, shout out to all 114 of y'all. We're doing NCLEX questions. Hey, I need 20,000 likes. TikTok fucking put me in timeout, and I don't like that. So I need for y'all to smash that like button. I need for y'all to share. I need for y'all to follow so I can get in front of people. Okay, I'm trying to get out of my TikTok funk. All right, and if you guys are new here, I want to know who you are, where you're from, and where you were at in your nursing journey. That's what I want to know. And if you're not a nurse, what are you doing here rocking with us today here on this Friday? You could have been anywhere else, but you're here with me, and I appreciate that. All right, here we go. Here's our answer in 3, 2, and the answer is B. Take vital signs and pulse oximetry readings every 4 hours. The nursing assistant's educational preparation includes measurements of vital signs, and an experienced nursing assistant would know how to check oxygen saturation by pulse oximetry. The staff member's level of education, knowledge, past experience, skills, activities, and competency are also evaluated and matched with the needs of all of the patients in the group of patients that will be cared for. It is very much within the scope of practice for a UAP or a nursing assistant to take vital signs. right? But they can't, well, hey, as nurses, we don't delegate what we can't eat, right? So you can't evaluate, you can't assess, you can't teach as an RN, all right? That's what, yeah, you can't, there you go. Is that Megan? I was gonna say, Megan, your jacket. But shout out to you for getting that. Shout out to everybody for getting that question right. All right, here we go. Question number 13. You are caring for a patient with emphysema and respiratory failure who is receiving mechanical ventilation through an endotracheal tube. So somebody else who is on the vent. To prevent ventilator-associated pneumonia, or VAP, which action is most important to include in the care plan, right? So, do I want to administer oral antibiotics as scheduled? Do I want to hyperoxygenate the patient before suctioning? Do I want to maintain the head of the bed 30 to 45 degrees? Or do I want to suction the airway when coarse crackles are audible? What are we thinking? What are we thinking? Shout out to all 113 of y'all. Hey, we're on the road to 20,000 likes. 20,000 likes. If you guys are just now joining, my name is Kevin. I am a registered nurse. I've been one for almost 4 years. I've worked OR, ICU, and PACU, as well as I was in the Navy for 16 years. 9 of those 16 years were all education as a master instructor. And I failed my NCLEX 3 times. So, and no part of me cares about what any of y'all have to say about that. Mostly it's because no one else cares, and I don't care. Because that test doesn't determine what type of nurse that you'll be. You determine what type of nurse that you're going to be. All right? So, just saying, here we go. And the answer is C, maintain the head of the bed at a 30 to 45 degree angle. Research indicates that nursing actions such as maintaining the head of the bed at 30 to 45 degrees, decrease the incidence of VAP. These actions are part of the standard of care for patients who require mechanical ventilation. Proper positioning and encouraging early mobility of mechanical ventilation patients aid in the prevention of VAP. So shout out to everybody that got that question correct. Hey, there's some things that we can do that we do not need an order for, right? So the biggest thing is that we don't want those things to stay stationary. We want that angled, right? So that way when we suction it out, It's not just sitting there, right? Because hey, when they're vented, it's nasty. I'm saying, just letting you know, it's nasty, secretions and all the nastiness, right? So make sure you guys understand that. And if you don't get it, circle back and you get that content, right? Yes, you are correct. It does prevent aspiration as well. Very, very, very true. Here we go. Question 14. You are evaluating and assessing a patient with a diagnosis of chronic emphysema. The patient is receiving oxygen at a flow rate of 5 liters per minute by nasal cannula. Which finding concerns you immediately? All right. So which one of these is just like, whoa. This requires my attention right here and right now. All right. Is it a patient has fine bibasilar crackles, respiratory rate of 8 per minute, sitting up and leaning forward over the night table, or has a large barrel chest? Now, when it comes to emphysema, what are the expected findings that you should see with that? What are the expected findings that you see with that, right? Versus what is unexpected that requires my attention? Everybody, large barrel chest, right? So those things that are expected, right? So I don't want to know that. I want to know what is concerning to me right now. I want to know what is concerning to me right now that is not expected with somebody with a chronic disease. All right. Everybody screaming B at me. All right. Well, let's see what the answer is. Here we go. In 3, 2, and the answer correct, as everybody was stating, is that it is the respiratory rate of 8. Nowhere in any book is it good for somebody's respiratory rate to be at 8 at all, right? 12 to 20. 12 to 20, right? So for patients with chronic emphysema, the stimulus to breathe is a low serum oxygen level, right? So this patient's oxygen flow is too high and is causing a high serum oxygen level, which results in a decreased respiratory arrest, right? So who is it? Carly says, I graduated in December, taking my NCLEX soon. I pray I pass. Hey, you can pray all you want. You can go to church all you want. And I want you to do that. However, you still got to put in that work. You still got to put in all that work, right? So, like I said, buckle down, do what you need to do, get your study on, study those harder sections that you have most difficulty with. For me, it was pharmacology, and I started there first, right? So, you can do it. Hey, we're out here, like myself, Nurse Amber, Who is it? Nurse C, Larissa. Who else is out here? Nurse Sugar. A whole bunch of folks out here helping y'all as students get to where y'all need to go. All right. So I'm just saying, you got to put in that work. If you scared, go to church. I'm just letting you know, but you still got to put the work in. All right, here we go. Question number 15. You are initiating a nursing care plan for a patient with pneumonia. Which intervention for cough enhancement should you delegate to a nursing assistant? This is also the UAP. Okay, so what can the UAP do? Can the UAP teach the patient about the importance of adequate fluid intake and hydration? Can the UAP assist the patient to a sitting position with neck flexed, shoulders relaxed, and knees flexed? Can the nursing assistant remind the patient to use an incentive spirometer every 1 to 2 hours while awake? Or can the nursing assistant encourage the patient to take a deep breath, hold it for 2 seconds, then cough 2 to 3 times in succession? What are we thinking? What are we thinking? When you start reading them like that, it's not new, if that makes sense. When you start practicing that way, it's not new stuff. Okay? What are we thinking? We got some B's, we got some C's. Hey, welcome everybody. Hey, we're on the road to 20,000 likes. Hey, I need 20,000 likes by the time I get to 20. Question 20. Yes, you're going to get 20 questions. I'm just saying. Make it happen. Get carpal tunnel for me. Make it happen. If you guys are new here, welcome. Make sure you guys smash that like button. You guys share and you guys follow. That is the trifecta to get me out of TikTok timeout. So, I'm trying to get out of timeout, y'all. But here we go. Here we go. Let us see what the answer is. All right. Let us see what the answer is in 3, 2. And the answer is C, reminding the patient to use an incentive spirometer every 1 to 2 hours while awake. A nursing assistant can remind the patient to perform actions that are already part of the plan of care. Why? Because the RN creates the plan of care. And so they can reinforce what the RN had already taught them. If that makes sense. All right. So if you don't understand the aspect of delegation, supervision, and assignment, which is management of care, which is the largest section on the NCLEX, you need to circle back and you need to get that content so you can apply it to the question. All right. So shout out to everybody that got that right. And here we go on to the next one. Ladies and gentlemen, I have an NCLEX course and you can join it right now for $7. Yeah, that's like less or like the same price of something that you would get at Starbucks. And I don't even drink Starbucks like that, but y'all know what I'm saying. Check it out at thebootnurse.com/special. I have 2 NCLEX reviews in there. They're self-paced NCLEX reviews where I break down the client needs categories out of the NCLEX test plan, as well as you get a next generation or a new generation NCLEX review that's also in there. All right, so you guys can check that out. Hey, there's already one person that came in here and they love the review. And I do lives in there as well where I go through content, and I'm going to start doing more questions and stuff in there as well. So if you're interested in joining the 7-day NCLEX course and the community, yes, you get a community part of that. You can join that as part of the package. It's thebootnurse.com/special. So make sure you guys go over there and check that out. Hey, we're in NCLEX season swinging, baby. All right, so I want y'all to get all this knowledge out there. Here we go. Question 16. You are making a home visit to a 50-year-old patient who was recently hospitalized with a right leg, deep vein thrombosis, and a pulmonary embolism. This sounds kind of familiar, right? The patient's only medication is enoxaparin, which is Lovenox subcutaneously. Which assessment information will you need to communicate to the physician, right? So what is important to tell the physician about the fact that they are getting Lovenox because they have a deep vein thrombosis and a PE, all right? And a pulmonary embolism. What's important? The patient says that their right leg aches all night. The right calf is warm to the touch and is larger than the left calf. The patient is unable to remember her husband's first name, or there are multiple ecchymotic areas on the patient's arm. What are we thinking? What are we thinking? Shout out to all y'all out here rocking. We're doing NCLEX questions on the road to 20,000 likes. I appreciate everybody hanging out while I'm in TikTok jail. All right, so appreciate you. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. She's altered. What makes you think that? Brittany, I'm not calling you out, but I mean, you said it. It's not like no one can see it. So where in the question does it say anything about her being altered? I'm asking you. Nana, thank you for the share. I appreciate you. All right, let's see. Well, let's see what the answer is. Let us see what the answer is in 3, 2, and the answer is C. Low oxygen to the brain. Look at y'all. Okay. All right. The answer is C, right? The answer is C. She is unable to remember her husband's first name, right? Because what does that tell me? That's a circulation issue. The change, yeah, you got it. I changed and I got it right there. That's why if you cannot 100% tell me why you are changing your answer, you better not change it. I'd rather you be, if you're wrong, I'd rather you stay wrong rather than you tell me that, oh, I think. Then you're going to start going back and forth. But the answer is C. Confusion in the patient. This age is unusual and may indicate an intracerebral bleed or bleeding associated with enoxaparin use. Because of the reduced effectiveness of the antidote, which is protamine, bleeding contraindications can be severe and life-threatening. That is a circulation issue, right? The patient is 50. So the patient is 50, but it's unusual for her to have that, right? The early sign is she's confused. If she's 50 and she can't remember her husband's name, why? Because she's on Lovenox. Right now, okay, I'm thinking to myself, why? Okay, so she's had a PE, she's had this, she's on Lovenox, anti-coag. Okay, why is that happening? Wait, why are you confused? Remember, level of consciousness. That is part of ABCs. It says it right there. Intracranial bleed could be associated with enoxaparin. All right. So those are the things you have to pay attention to. That is where you use your critical thinking in order for you to make a clinical judgment. And those that chose C made a very good clinical judgment. So shout out to y'all. All right. Kate, I see you in there. Hey, get me to 20,000 likes. Make it happen. If anybody's out here trying to get their paramedic on, Medicate is my girl and she will get you right. Here we go. Question 17. You are providing care for a patient with recent diagnosed asthma. All right. Which key points would you be sure to include in your teaching plan for this patient? Select all that apply. Avoid potential environmental asthma triggers such as smoking. Use the inhaler 30 minutes before exercising to prevent bronchospasm. Wash all bedding in cold water to reduce and destroy dust mites. Be sure to get at least 8 hours of rest and sleep every night, and or avoid foods prepared with MSG. What are we thinking, y'all? What are we thinking? Kate is telling me A. Hey, so select all that apply. So I need multiple answers. Select all that apply. I need multiple answers. What are we thinking? A, B, E. Okay. A, B, D, and E. Okay, Tanya. Cindy says A and B. Drew says A, B, C. All right, what else are we thinking? Anton says A, B, and D. Claire says A and B. I'm just calling y'all out. A, B, C. Okay. All right. A, B, and D. That's what Jazzy says. Samantha, I see you out there. A, B, C. All right, y'all. Let's see. Let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is A, B, D, and E. All right. Asthma comprises a range of diseases and has a variety of heterologic phenotypes. The recognized factors that are associated with asthma are a genetic predisposition, specifically a personal or family history of atopy or whatever, bro. Allergies, eczema, hay fever, and asthma. All right, my daughter has asthma. That's how I know. I wouldn't say that's cheating, but I mean, hey, you use what you got. Environmental control is vital for that one, right? For reoccurring issues, such as avoiding tobacco, dust mites, animals, and pollen, right? Because those are triggers that can trigger somebody's asthma, right? So, hey, we learn something new every day. And here's the thing. If you didn't get it right, circle back, get the content, keep doing your questions, and doing your rationales. The rationales help solidify and retain what you are learning, all right? So, here we go. Question number 18, you're providing nursing care for a newborn infant with respiratory distress syndrome who is receiving nasal CPAP ventilation. Which complication should you monitor for this infant? Is it pulmonary embolism, bronchitis, pneumothorax, or pneumonia? What are we thinking? Hey, if you learn something new, I love that. That's the whole point. If you learn something new, I'm glad. I'm glad that you have. All right. So think about this. You have a newborn who is getting CPAP. What is a CPAP? What does a CPAP ventilation do? right? And so what could I expect from that? Think about a baby's lungs. Think about a baby's lungs. Those things is teeny tiny. Fun fact, if you didn't know, beta 2 works on lungs, 2 lungs, beta 1 heart, 1 heart. Okay, I got you, Kate. I got you. That is a fun fact. That's not really a fact I need to know for NCLEX, but Kate, I appreciate you. Ma'am, we've had this conversation before. We've talked about this. All right, what are we thinking, y'all? What are we thinking? Everybody's telling me C. I saw a couple of D's in there, so let's see what we got. Teamwork is great work. There's your 20,000. I love it. I love to see it. Nurse 74. I love to see it. Here we go. Here we go. Let us see what the answer is in 3, 2. And the answer is a pneumothorax. The most common complication after birth for infants with RDS is a pneumothorax. Alveoli rupture and air leaks into the chest and compresses the lung. That's all that positive pressure inside of that negative space, right? We don't want that. It's negative space. We need negative space. The lungs need to be up against the walls, right? So where was I at? Oh yeah, which makes breathing difficult. Pulmonary air leaks or pulmonary air leak syndrome, such as pneumothorax or pneumomediastinum, may also present as respiratory distress, but the onset of symptoms may be more acute. What are we thinking, y'all? Wasn't sure about this one, but that's adults for high PEEP. Yeah. So it's different for babies. Much more different for babies, because remember, babies are all hypersensitive to everything. They have smaller everything that we have. All right. So here we go. Shout out to everybody that got that question right. And of course, if you didn't, circle back. Remember, we're doing management of care, which is the largest section on the NCLEX for both RNs and LPNs. LPNs is coordinated care, but it's 18 to 21%. So that's what is it? Delegation, supervision, assignment, right? Prioritization, right? So here we go. Question 19. You're responsible for the care of a post-operative patient who had a thoracotomy, right? The patient has been given a nursing diagnosis of activity intolerance. Which action should you delegate to the nursing assistant? So can the nursing assistant instruct the patient to alter rest and activity periods? Can the nursing assistant encourage, monitor, and record nutritional intake? Can they monitor cardiorespiratory response to activity? Can they plan activities for periods when the patient has the most energy? Can a nursing assistant do any one of those? What are we thinking? Shout out to all 93 of y'all out here rocking. Hey, the goal, let's get to 30,000 likes. Let's see what we can do, all right? Y'all keep smashing that like button. Y'all sharing, y'all follow. If you're new here, welcome. We are doing NCLEX questions both for RNs and PNs. Got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. If you're in nursing school right now and you haven't shared this to your cohort in cahoots, what are we doing? What are you doing? And I'm going to need for you to fix yourself. I'm going to need for you to do that for me, all right? So, and of course, if you're new here, I want you to like, share, and follow the stream. And I want to know who you are, where you're from, and where you're at in your nursing journey. All right, here we go. Here we go. Let us see what the answer is in 3, 2. Hey, by the way, Nurse 74, I see you commenting on when people were talking, real negatively about people failing the NCLEX and they would never want them to be their nurses. Hey, I love the clapback. I love the clapback. When do you have your classes? These are done right here, are Monday, Wednesday, Friday at 5:30. All right, but the answer is B, encouraging, monitoring, and recording nutritional intake. The nursing assistant's training includes how to monitor and record intake and output. All right. After the nurse has taught the patient about the importance of adequate nutritional intake for energy, the nursing assistant can remind and encourage the patient to take in adequate nutrition. Management of care. Right? That's a management of care aspect type of question. You as the RN need to know what everybody else does. In LPNs, you need to know what you can and can't do and what you can and cannot accept. All right? Just because you're an LPN doesn't. The whole point of delegation is so you don't have to do the things that the UAPs do. And there's also things that you cannot do because it's not your scope of practice like the RN. So you can't do blood transfusions. I don't care what your state says. According to NCLEX, you can't do it because it's national. You can't do anything with PICC lines. You can't do anything with central lines, right? You can do Foley's, right? You can do wound care, right? So you got to recognize. What do you recommend for HESI prep? Which one? Which HESI prep? Here we go. Question number 20. You are supervising a nursing student who is providing care for a patient with thoracotomy. Let me reread that. You are supervising a nursing student who is providing care for a patient with thoracotomy with a chest tube. What finding would you clearly instruct the nursing student to notify you about immediately? All right. So nursing student, oh my God, help. And then at that point, you're going to be like, oh, well, what needs help? What needs my attention as the RN, right? The chest tube drainage is 10 to 15 mLs per hour. There's continuous bubbling in the water seal chamber, complaints of pain in the chest tube site, or the chest tube dressing dated yesterday. Think about air leak. We got C's, we got C, we got and B. Okay. So here's the thing. If somebody has a chest tube, is it expected for them to have pain at the chest tube site? Think about that. Is it expected for the patient to have pain at the chest tube site? So when somebody has a chest tube, what is expected and what is not expected? All right. Remember, expected versus not expected. This is part of management of care, right? It says B could be and not had an MD do that. True. So continuous bubbling, right? That's where we got the choice between B and C, right? So think about that. Is there anything wrong with the chest tube being dated yesterday? Is there anything wrong with it having 10 to 15 mLs per hour? Right? So think about, though, that's how you have to critically think. What's expected versus not expected with the certain things that are being done with your patient. All right. Well, let's see what the answer is in 3, 2. And the answer is B, continuous bubbling in the water seal chamber. All right. Continuous bubbling indicates an air leak that must be identified. With the physician's orders, you can apply a padded clamp to the drainage tubing close to the occlusive dressing. If the bubbling stops, the air leak might be in the chest tube insertion, which will require you to notify the physician. Shout out to you, Kate. All right. Intermittent at the water seal. There you go. If the air bubbling does not stop when you apply the padded clamp, the air leak is between the clamp and the drainage system, and you must assess the system carefully to locate the leak. Right. So shout out to everybody that got that question right. Remember, of course, I'm going to have pain at the chest tube site because somebody just cut into me and put a tube in my chest. I got that question right. Remember, of course, I'm going to have pain at the chest tube site because somebody just cut into me and put a tube in my chest. I'll be one to tell you that I got a mentor. Oh, I froze. I'll be one to tell you. What's up, Stephanie? I'll be one to tell you that I got a mentor because I just did not understand what was going on. I had a lack of accountability. My time management was terrible. Like I had no idea how to track myself. So I got a mentor, and that mentor instilled upon me what I instilled upon everybody else. And that is where I like to do coaching and mentoring, right? It doesn't matter if you've taken the test once or if you've taken it 12 times. It doesn't matter. Because I'm telling you right now, nobody's ever walked a day in your shoes. So if you're that individual who has a hard time taking the NCLEX or anything like that, you need guidance, you need time management, you need accountability, you need somebody to get real military with you. I'm that dude. All right. But if you're ever interested in coaching and doing one-on-one sessions to help you conquer the NCLEX on your next or first attempt, check me out at thebootnurse.com/coaching. All right. Here we go. Question number 21. Nurse 74, I will welcome any of your nurses to work with me. I love precepting new nurses. Keep it up, Kevin. Hey, absolutely. Hey, I was a preceptor as well, and I love nursing students. I love them. You want to know why? It's because other people have the absolute audacity to say, oh, no, I don't want students. And I'm like, bro, did you forget that you used to be a fucking student? Like, so we just forget that. We forgot where we come from because we got all this knowledge and we don't want to instill it upon these individuals that are trying to come up and replace us. I don't know. It's weird. It must be a military thing because in the military, we don't do shit like that most of the time, right? Anyways, so I definitely send them your way. Question 21. You are supervising a student nurse who is performing tracheostomy care for a patient. Which action by the student should you intervene? All right. So what did the nursing student do that was incorrect that requires the RN to be like, no. Can't do that, right? Is it suctioning the tracheostomy tube before performing the trach care? Is it removing old dressings and cleaning off excessive secretion? Is it removing the inner cannula and cleansing using universal precautions? Is it placing the inner cannula and cleaning the stoma area? Or is it changing the soiled tracheostomy ties and securing the tube in place? What are we thinking? Shout out to all 86 of y'all out here rocking. We're doing NCLEX questions. Make sure you guys like the stream. You guys share the stream and you guys follow. When you guys follow, hit that notification bell. All right. Also, check out my link tree in my bio. I have my YouTube. I have my Instagram over there. We have no idea what's going to be happening with TikTok, because, the government. So make sure you guys go over there and follow me on YouTube as well as follow me on Instagram. I also post over there. I've been more active on TikTok, but I'm been more active between TikTok and Instagram. So make sure you guys check that out as well. Okay. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. But of course, the answer is C. Removing the inner cannula and cleaning using universal precautions. When tracheostomy care is performed, a sterile field is set up and sterile technique is used. Standard precautions. Hold on a second. Man, I swear it's like TikTok is out here just like, hey, are you still going live? Of course I'm still going live. Like, what does that mean? Anyways, where was I? Standard precautions such as washing hands must also be maintained, but are not enough when preparing tracheostomy care. The presence of tracheostomy tube provides direct access to the lungs for organisms. So sterile technique is used to prevent infection, right? All of the other steps are correct and appropriate, but this is the most appropriate, right? So shout out to everybody that got that question right. TikTok is wild, like it's crazy. Those are the ones who don't have good nursing skills. My daughter asked that. I precept her and I did. I love that. I'm glad. I mean, who better to teach your daughter than you, right? So yeah, TikTok is wilding right now. Like, it's like, hey, are you still streaming? Bitch, you see that I'm still streaming. Like, what kind of questions? Oh my God. Here we go. Question number 22. You are supervising an RN who was pulled from the medical surgical floor to the emergency department. All right. So now I'm an RN going to a place I ain't never been before, right? The nurse is providing care for a patient admitted with anterior epistaxis, which is a nosebleed, right? Which of the following directions would you clearly prove to the RN? Select all that apply. Which of these directions would you clearly prove to the RN? Select all that apply. All right. So is it A, position the patient supine and turn on his side? Do I want to apply direct lateral pressure to the nose for 5 minutes? Maintain universal body standard precautions or body substance precautions? Apply ice or cool compresses to the nose? Man, that Celsius got me crazy right now. I'm seeing double. Or is it E, instruct the patient to not blow the nose for several hours? What are we thinking? Like Netflix? Wait, what happened? Oh yeah, just like Netflix if I'm still here. Netflix, I'm still here watching Black Mirror. Stop playing games with me. Hey, by the way, if y'all ain't seen Black Mirror, y'all gotta watch it. It's crazy. It's another reason why I stay off my phone sometimes. Or I think Amazon Prime does it now. Hell, YouTube does it now too. Are you still there? YouTube, you know that I'm still watching Blaze in the Monster Machine with my 2-year-old son. Stop playing games. Oh my goodness. But shout out to y'all. All right, what are we thinking? B, C, D, and E. Who is that? Is that Dadry? Is it Dadry? Thank you for the follow. Sorry, B. Sorry. Okay, I got you. So B and C, B and D. All right, well, let's see what the answer is, y'all. In 3, 2. And the answer is B, C, D, and E. Let us see why. Epistaxis is relatively common, but rarely fatal. Anterior bleeding is usually managed by distal pressure, gentle chemical cauterization, or nose packing. Posterior bleeding, which is less common, is characterized by massive bleeding that's initially bilateral. This bleeding may be more difficult to control. All right. So shout out to everybody that got that right. So for B, it says, tell her to breathe through her mouth while she holds firm pressure on the soft flesh of the nose for at least 10 minutes. Now for C, it says you want to use the universal precautions such as gloves, a gloves gown, and a face shield. What was D? So cooling the nape of the neck is said to reduce reflex contraction or constriction of the mucosal vessels of the nose. Okay, and then for E, it says the nasal packing will be left in place for 3 to 5 days. So shout out to y'all. TXA word. Hey, Kate, TXA ain't even on here. Stop doing that. Hey, Kate, you're gonna confuse people. Don't do that. We talked about this, Kate. We talked about that. Well, I tell you, you're smart for your own good sometimes. We talked about that. Question number 23. You are the preceptor for an RN who is undergoing orientation to the intensive care unit. The RN is providing care for a patient with ARDS who has just been intubated in preparation for mechanical ventilation. You observe the nurse perform all of these actions. For which action must you intervene immediately? All right, so something's not going right, or something didn't go right, or they're not doing something right. Hey, what are we doing? Right? Is it A, assess for bilateral breath sounds and symmetrical chest movement? Auscultate over the stomach to rule out esophageal intubation. Mark the tube 1 centimeter from where it touches the incisor tooth or nares, or ordering a chest x-ray to verify that tube placement is correct. What are we thinking? See, look at you, Kate. You done already confused somebody about what TXA is. Don't worry about it. Don't worry about TXA. No, Kate, forget it. Since Kate decided to say TXA, Kate, tell her what TXA is. Do it right now. Shout out to everybody out here rocking. We're doing NCLEX questions. These are both for RNs and LPNs. All right. You guys can check them out at nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. Hey, and if anybody's inside of the 7-day NCLEX course and you guys are a part of the community, I'm going to be doing a live on Monday where we're going to be going through some more NCLEX questions, and we're going to go more into depth, especially to where I can say the C word and not get banned, because that's just part of what it is. So if you guys are not part of the 7-day NCLEX course, where you get 2 on-demand NCLEX reviews, as well as content that's being added every month. Make sure you guys go check it out at thebootnurse.com/special. It's right there at the bottom, okay? But let's see what our answer is in 3, 2. What do you say? It says works at making clot factors work better, essentially. And the answer is C. Mark the tube 1 centimeter from where it touches the incisor tooth or nares. Now, the esophageal tube should be marked at the level where it touches the incisors or nares. This mark is usually to verify that the tube has not shifted. If the patient has an endotracheal tube, check for tube spillage into the right mainstem bronchus, as well as inadvertent extubation. Right? So, not saying that none of these are right. As a matter of fact, all of them are right. But which one is more right? It says, I also say the special ingredient on Celsius works too. Hey, look, that special ingredient is great. Starts with an M, ends with an amphetamine. I'm just playing. But shout out to all y'all that got it right. If you got it wrong, make sure you understand about mechanical ventilation. All right. It's part of airway and the respiratory sections of anywhere that you go. All right. So make sure you guys go check that out. All right. Here we go. Question number 24. You have just finished assisting the physician with a thoracentesis for a client with recurrent left pulmonary effusion caused by lung cancer. The thoracentesis removed 1,800 mLs of fluid. Which patient assessment information is important to report to the physician? Hey, doc, yep, right? So what is important? What is important? Kate will get you right. That girl's, she's smarty pants. All right, is it A, a patient starts crying and says that she can't go on with treatment any longer or much longer? The patient complains of sharp stabbing chest pain with every deep breath. The client's blood pressure is 100/48 and her respiratory rate is 102 beats per minute. Or the patient's dressing at the thoracentesis site has 1 centimeter of bloody drainage. What are we thinking? Nana says B. Oh, like, why do you keep tagging me? I can see you on there. It's all good. What's the map? Stop it. Stop. Because now people are going to ask what the map is. Every time you do that, you're answering them. You're answering the questions, Kate. You better not leave either. The people are going to be like, what's the map? I'm like, I'm not telling you. Kate's going to do that. It's a mistake. Nana, you're good. Is it Nana or Nana? It doesn't matter. But here we go. Let's see what the answer is, y'all. Here is our answer in 3, 2, and the answer is C. The patient's blood pressure is 100/48 and the heart rate is 102 beats per minute. Removal of large quantities of fluid from the pleural space can cause fluid to shift from the circulation into the pleural space, causing hypotension and tachycardia. The patient may need to receive IV fluids to correct this. Why? It's because we're pulling fluid from them. Help. Get my fluid back up there, right? So essentially think about water in your pipes of your house. It has to be pressurized, right? When the pressure is decreased, the water is not where it needs to be, right? So think about the pipes in your body are just like the pipes in your house. It needs to be pressurized. And when the pressure gets low, you're going to notice that your water pressure is going to get low. It's just dribbling. So essentially think that your veins and your vessels and your arteries are going to be the same exact way. All right. So hypovolemia. There you go. There you go. Here we go. Question number 25. You have obtained the following assessment information about a 3-year-old who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? Most immediate follow-up. Oh, you were thinking of pericarditis. So, Vicky, what is pericarditis? Think of peri, think of cardiitis, right? So 3 sections. Peri being around, carditis, or cardi meaning B, I'm just playing, but meaning the heart, and then itis and the inflammation. So it's the inflammation around, or it's the inflammation around the heart, right? So that's how you have to think about that. And we weren't necessarily talking about that. Okay. So for this one, is it A, frequent swallowing, hypotonic bowel sounds, complaints of sore throat, or heart rate of 112 beats per minute? What are we thinking? So, I mean, think about it. If I just have my tonsils taken out and my tonsils are not in my arm, they are in the back of my throat, and all of a sudden I start having this, what could it be? Everybody's telling me A. Nurse Babe says A. All right, here we go. Let's see what the A is. Let's see what the answer is in 3, 2. And the answer, of course, is A. It is frequent swallowing. So after a tonsillectomy, frequent swallowing after a tonsillectomy may indicate bleeding. You should inspect the back of the throat for evidence of bleeding. The other assessment results are not unusual in a 3-year-old after surgery, right? You got it. That's right. You got it. Because think about it. They could have bleeding in the back of the throat, right? And at this point, if I have bleeding in the back of the throat, I'll have a circulation issue, as well as I have continuous bleeding in the back of the throat. I can then have an aspiration issue, right? And we don't want either one of those to be happening for this 3-year-old. Okay. So shout out to everybody that got that right. If you got it wrong, circle back. All right. Get your content. Make sure you get your Q&A and your rationale. All right. Ladies and gentlemen, of course, make sure you guys check out everything that I have going on. Go over here and get you this. It's 42 pages of awesomeness, and you don't get a fanny pack, but you at least get to see me in a fanny pack. All right. 42 pages of a free download. You guys check it out, thebootnurse.com/test. Also, I have an ebook called the NCLEX Victory Guide, because the path of conquering the NCLEX begins with you. I don't care what your school didn't provide you. All right. But it still begins with you, because your school's not taking the exam, you are. But you can check that out. Over 700 pages, EKG interpretation, pharmacology, delegation, supervision, questions. You guys can go over there, check that out, thebootnurse.com/victory. If anybody's ever interested in joining the 7-day NCLEX course, where I have 70 videos over there, y'all. 70. You guys can you get 2 NCLEX reviews that are on demand. You can do it on your own, right? But I got 70 videos that are over there, to include content videos. You guys can check it out at thebootnurse.com/special, starting at $7. So you guys can check that out. The fanny pack is wild, ain't it? So, and then of course, if you're ever one of those individuals that needs help with the NCLEX and you want one-on-one personal guidance, where you talk to me for at least an hour, but on average it's like 2 hours, and you want me to break down questions with you, you guys can check out the 7-day, you guys can check out the NCLEX coaching and mentoring. But ladies and gentlemen, I appreciate you guys hanging out with me. TikTok put me in jail. That's okay. I appreciate all 80 of y'all that still rocked it with me. I love all the participation. I love all the gifts. I love all of it. Is it Marissi? The coaching, it varies between person to person, but if you're interested, you can check out on my main page. You'll see a link tree, and then tap on the NCLEX coaching and mentoring, follow all the prompts, and then that'll take you to me. All right. And that's the same thing for you, McKay. I say the same thing, because it all just depends on what you need. Some people need a lot, and some people only need a little. So it all just depends on where you fall with regards to that. I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. But I will always agree with Nurse Amber, is that go out there and get you a good set of questions, like from UWorld, Kaplan, Archer, or whatever the fact. All right. Nurses Labs, they're good, to get the foundation, but you really want those other really thought-provoking questions. Okay. 7-day NCLEX course and community. You get a community, ladies and gentlemen, where I do live sessions in there for an hour and a half. I go through content. We're going to be doing questions and answers. I have challenges over there for you. Hell, there's one challenge over there where somebody just won a one-on-one call with me for at least 2 hours. You see what I'm saying? Because she answered all of the questions right for our EKG interpretation. So you guys can check that out. That's part. Hey, you get it. You get a community part of the course. All right. And you can join for $7. All right, go over there and check it out. bootnurse.com/special. Get that download. Check out my book that's coming out in June. And of course, if you're looking for one-on-one coaching, you guys can check that out as well. How can I join the Facebook group? So the Facebook group that I have, it was only for people that are a part of the course, but that Facebook group is going away because now the group that I now have is a part of the community and it's on my website. So that's the only way that you can be a part of it is if you're a part of the course. All right. So you can check that out as well. Hey, but guess what? Guess what though? I lied. Question number 31. So guess what? Everybody else left, but guess what? I still got some questions for y'all. Let me into that EKG set. Hey, Kate, I got you. I was just going through some things, finalizing them, and I'm going to be recording those here real soon. But anyways, here we go. Question number 31. A client arrives to the emergency department after suffering multiple physical injuries, including a fractured pelvis from a vehicular accident. Upon assessment, the client is incoherent, pale, and diaphoretic. The vital signs are as follows. They have a 97 temp, blood pressure 60/40, respiratory rate 143. Heart rate of 143 and a respiratory rate of 30. The client is most likely suffering from which of the following shocks? What are we thinking? Hey, Cece, listen, I did sneak that in there, right? Because guess what? Hey, so many people come in here and they take, then they leave, then they don't realize what I got. I got some other stuff for them. You know what I'm saying? Everybody's telling me hypovolemic. Now, what in the question could tell you that it's hypovolemic shock? What is the biggest kicker that's in there? The biggest thing that's stated in the question. Shout out to everybody that just now joined. Hey, y'all. Hey, people thought it was over, but we still doing NCLEX questions. Talking about blood pressure. Okay. Vital signs, pelvic injury, bleeds a lot. Yeah, because the pelvis can hold everything. Hey, listen, look, when I was working in the ER, there was a dude who worked in the industrial district working on the train, the railroad yard. He fell off of a train. And when I tell you my man's pelvis, he had internal bleeding and he died on the way to the hospital. When he had internal bleeding all the way into his pelvis and into his scrotal area, listen, it was wild. Absolutely wild. All right, so shout out to everybody got that right, but it is hypovolemic, right? Hypovolemic shock occurs when the volume of the circulatory system is to deplete to allow adequate circulation to the tissues of the body. A fractured pelvis will lose about 1 liter of blood, hence symptoms such as hypotension, tachycardia, and tachypnea will occur. If left untreated, these patients can develop ischemic injuries of vital organs, leading to multi-system organ failure. All right. So it says that's why we bind. Exactly. That's why we bind or pelvic bind. Exactly. Hey, and if you don't have a pelvic binder, you know what works? A really good sweater or even a towel. You know, you can use whatever you got. But shout out to everybody that got that question right. All right. Here we go. Question number 32. Cole is an emergency room nurse who encountered a patient who is suspected carrier of a biological agent. Which of these, if found in the patient, is not classified as a category A biologic agent? Is it anthrax? Is it tularemia? Is it botulism? Is it melanosis? Or is it the plague? What are we thinking? And I know everybody's saying, Kevin, I don't know. Guess what? Guess. Give me a guess. What are we thinking? Samantha's telling me C. Okay. Everybody's telling me C. Are y'all just telling me C? Oh, Kate, you think it's E, huh? Look at you, Kate. Look at you. Everybody's telling me C. A and C? No, so it's only one. It's only one. It's not a select all that apply. All right, y'all. Is that Nick? Nick, you're the one who messaged me, right? I think you messaged me earlier. But here we go. Here's our answer in 3, 2. And the answer is D. All right, it's melanosis. So melanosis belongs to the category B, priority pathogen. These agents are moderately easy to be transmitted and can result in moderate morbidity rates. All right, and that's part of emergency care. You'll see that in like bioterrorism, right? They probably ask you like maybe 2 of those, maybe, huge maybe, right? But you got to understand how the biological terrorism things happen. with regards to like, hey, if there was a gas somebody gassed, a whole crowd of people, like, well, you got to know exactly like what's happening. But the biggest thing you got to know is decontamination, not harming yourself and harming everybody else that's inside of the operating room, the emergency room. All right. So it's okay if you didn't get it right. You knew it was D. Why you lying? Why you lying, Morgan? Look at you. Here we go. Question number 33. A 15-year-old male client was sent to the emergency unit following a small laceration on the forehead. The client says that he can't move his legs. Upon assessment, respiratory rate is 20. He has a strong pulse and capillary refill is less than 2 seconds. Which triage category would this be assigned to? Red, black, yellow, green, or white? What are we thinking? What are we thinking? Now, if you guys join me in the parlor, we'll be serving some white cake. Goddamn Calvin candy. All right, here we go. What are we thinking, y'all? Everybody's telling me C. Kate, are you sure it's C? Are you sure? You told me that earlier and you were wrong. Shout out to all 63 of y'all. Hey, if you're new here, we're doing NCLEX questions. People thought we were done. Surprise. Happy Friday. You got more questions today. All right, what are we thinking? Got a bunch of people saying C. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And make sure you smash that like button. You guys share and you guys follow. That is the trifecta to get me out of TikTok jail. I need this anyway. I'm ready. That's what I'm talking about. Shout out to Kentucky. I ain't never been there, so I don't really know the. Sorry, Morgan. But yes, the answer is C. It is yellow. It is yellow. The client is possibly suffering from a spinal cord injury, but otherwise has a stable status and can communicate. So the appropriate tag is yellow. This is delayed. This is what we would call delayed, right? If individuals can breathe spontaneously, follow simple commands, and have distal pulses with a normal capillary refill, they are tagged, delayed, and given the code yellow. All right. So shout out to everybody. Who's going to C-spine that man? You are, Kate. You're going to C-spine him. All right. So shout out to everybody that got that right. This is all about triage, right? Triage. Hey, listen, triage, it's French for sort, right? So we sort them based off of their acuities. All right. Here we go. Question number 34. An ER nurse is handling a 50-year-old woman complaining of dizziness and palpitations that occur from time to time. The EKG confirms the diagnosis of paroxysmal supraventricular tachycardia. All right. The client seems worried about it. Which of the following is an appropriate response of the nurse, not of Kate? So is it you can be discharged now? This is a probable sign of anxiety. The physician will prescribe some blood thinning medications to lessen the episodes of palpitations. We'll need to keep you for further assessment. You may develop blood clots, or you have to stay here for a few hours to undergo blood tests to rule out a myocardial infarction. Definitely A. I can't stand you. I can't stand you, Kate. We got some D's. Kate is definitely saying A. All yours. I appreciate the rose. Thank you. Morgan, you see how she do me? She wild out here. Wow, out of control she is. A bunch of people saying D. Okay. You think it's D? Hey, if you're wrong, hey, say it with confidence. You don't know. You'll find out. It says, hey, hold on. It says, hey, Kevin, thanks for having having a live review. I passed the NCLEX with 86 items. All the best. My man, that's what I'm talking about. Abadonio. Y'all, shout out to you, Abadonio, right? Congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If you could provide any piece of advice to anybody that is going to take their exam here come soon, what would it be? Once again, congratulations to you. Abadonio has been a frequent flyer to the lives, all right? So just letting you guys know, hey, these lives, the coaching, the 7-day NCLEX course, they work. They work. Definitely D. Let's see what the answer is. And the answer is C. Hold on. Yeah, the answer is C. I want to make sure I was right, but the answer is C. We'll need to keep you for further assessment. You may develop a blood clot, right? Yeah, Brittany's like, what? All right, well, we finna find out what that answer is, though, right? There it is. You thought so? So PSVT is characterized by episodes of rapid heart rate that occur periodically and stop on their own. PSVT decreases cardiac output and can result in a thrombus. These clots could turn into an embolus, which could eventually lead to a stroke. Treatment for PSVT or in a patient is dependent on the type of rhythm presented on the electrocardiogram and the patient's hemodynamic stability. All right. It says, I graduate in 2025. Prayfully. Look, you going to graduate. I speak it into existence right now. It makes sense. It says, thank you. Massive respect to your live and your review are the best so far. I appreciate that. Thank you so much. Hey, no, the best thing that you could do is just tell everybody that I do this and tell everybody I got a review. So shout out to everybody who's out there passing, doing great things. All right, here we go. Question number 35. A 20-year-old male client was brought to the emergency department with a gunshot wound to the chest. In obtaining a history of the incident to determine possible injury, the nurse should ask which of the following questions. Not Kate. How long ago did the incident occur? What was the initial first aid done? Where did the incident happen? What direction did the bullet enter into the body? What are we thinking? Shout out to you, Princess. Graduated in 2025. Definitely not D. Okay. Okay, Morgan. Samantha's telling me A. Brittany told me D. Okay. Shout out to all 7 of you guys and gals out here rocking out with me. We're doing NCLEX questions. Hey, we usually stop sometimes at 30. Sometimes at 25, but we at 35 today. So I appreciate everybody that stayed and that didn't want to leave because now you're still getting all these knowledges in. Yeah, D is so wrong. Right? Maybe. But let's see what the answer is. Shout out to everybody out here. All right. Here we go. Here's our answer in 3, 2. And the answer is definitely D. It was definitely D, ladies and gentlemen. Y'all, listen, I'm about to block Kate and Morgan because y'all are out here confusing folks. Anyways, no, I'm just playing, but here we go. The answer is D. What direction did the bullet enter into the body? Sarcasm at its finest, right? The entry point and the direction of the bullet will predict the injury of the client. In gunshot wounds, due to the high velocity kinetic energy of the bullet, the pathway is often unpredictable in nature as well as the internal organs that may be affected. The most common organs injured are the small and large bowels at 50% and 40% respectively, right? I love everyone in here though. Hey, Morgan, I appreciate you. We love you, Morgan. We love you. All right. So shout out to everybody that got that question right. All right. Understand these are emergency medicine. So the medical emergency aspects of NCLEX questions are part of physiological adaptation, but then they also could be a part of management of care depending on what the question is asking you. Okay, here we go. Question number 36. When attending a client with a head and neck trauma following a motor vehicle accident or vehicular accident, whatever, the nurse's initial action is to what? What is the very first thing I should do for somebody with a neck and head trauma? All right, provide O2, initiate IV access, immobilize the cervical area, or do oral and nasal suctioning. Oh my God. What are we thinking, y'all? What are we thinking? Shout out to everybody out here. We are doing NCLEX questions. They are part of management of care, which is the largest section on the NCLEX exam at 18 to 21%. And if you're an LPN taking your exam, that is referred to coordinated care or coordinating care, which is the same percentage. So LPNs, you guys need to realize that you guys do the same thing that RNs do. I'm sorry, not the same thing. You guys learn the same content that RNs do. All right, here we go, y'all. Let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is C. Immobilize the cervical area. Clients with suspected or possible cervical spine injuries must have their neck immobilized until formal assessment occurs. Maintain cervical spinal immobilization and minimize neck movement, particularly during transport. Beware that absence of neurologic findings does not eliminate the possibility of cervical cord injury or spinal cord injuries. Okay, so think about it. It said, what is the very first thing that we do? All right, very first thing. Remember, if you don't understand this or if you got it wrong, I want you to understand. I want you to RTFR. RTFR means to read the fucking rationales. I hope TikTok doesn't ban me for saying the F word, but we're all nurses out here. That's our favorite word. Kate, you're a paramedic, and I know that's your favorite word, and I'm pretty sure you have a good dictionary on that. I'm just letting you know. But understand, read the rationale. Read the rationale. All right. I'm about to be like iCarly. What's your favorite word? Probably fuck. All right. Anyways, ladies and gentlemen, that truly is it. There are no more questions. I appreciate everybody participating. Like I said, I still got these questions off nurseslabs.com. So you guys can go over there and check those out for yourself. It says no, one more day. No, really, it's really over this time. I promise. I promise. I'm not going to be like, oh, got you again. I don't got no time for all that today. But I appreciate all the love, all the likes, all the gifts. That while they're not mandatory, they are 100% greatly appreciated. So thank you so much for those. 7-day NCLEX course, y'all. Y'all can join it for $7. $7. All right. Hey, I got 70 videos over there to include 2 NCLEX reviews. So you guys can go over there and check those out as well. 7-day NCLEX course is over at the bootnurse.com/special, as well as I got a free download. You guys can check out my book, Conquer It, which is coming out June 5th. You guys can pre-order it right now on Kindle. And then if you get it on Kindle, you can switch to the paperback when that's available. Also, if you're one of those individuals that needs one-on-one coaching where you get me, giving you accountability, breaking questions down with you, helping you understand content, giving you the motivation, giving you the mentorship to do with NCLEX and then beyond, come check me out, thebootnurse.com/coaching. Go over there, fill the questionnaire out, book a call with me, and let's see what we can do for you. I need to join. Go over there and join it. Go over there and join it. All right. So with that being said, ladies and gentlemen, I'm going to hang out and I'm going to talk to y'all for essentially however long I need to talk to y'all. My hair's looking kind of crazy right now, but that's okay. How y'all doing? Shout out to all 60 plus of y'all who are rocking with me. We just got finished doing NCLEX questions. So if you're new here and you missed it, sorry. I even gave y'all an additional 6 questions. Just saying. So for those that are new, my name is Kevin. I've been a nurse for 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years. 9 of those 16, I was a master instructor. So I was, teaching, taught a surgical technology program as well as other programs as well. And it was great, which brought me to TikTok to teach you guys. So I appreciate everybody being here. But of course, I want to know who you are, where you're from, and where you're at in your nursing journey. And what questions do you guys have about nursing, NCLEX, how to get into school, how to push through school, how to get through it, all that stuff. You guys ask your question. I'm going to hang out. I'm essentially going to hang out until I get tired of not hanging out. So let me see what's up. An 8-year-old drooling. He got an 8-year-old patient comes into the ER drooling. What's he got? Epiglottitis. Definitely D. What time do you start? So my lives usually are Monday, Wednesday, Friday at 5:30. Thank you. I'm from Mexico. Shout out to you, Karen. You're from Mexico? I've been to Mexico. I've been to Monterrey and Reynosa. I've been there. So it's cool. It's Central Time. Yeah. So 5:30 Central Standard Time. Texas time, because I live in Texas, specifically San Antonio. So, but Karen's from Mexico. Where's everybody else from? Kate, I already know where you're from. I don't want to hear from you. It says, I live in CD Juarez. Okay. All right. Shout out to you. It says, Miss Dunn failed my NCLEX 2 times. Okay. User 92. Hey, so you failed your NCLEX twice. So my question to you now, what are you doing now to prepare for your 3rd time? All right. I'm trying to take the subtle approach that Nurse Glamber takes. If you guys don't know who she is, she's another NCLEX strategist. She's out here with me doing in these TikTok streets trying to get y'all right for NCLEX. I'm stealing kind of some of her thunder. But yeah, so what are you going to do? What are you going to do? Nana from the UK. Nana, I think we were supposed to have a call at one point. Shout out to Jersey. I'm Vicky from Nigeria, practicing in the UK currently. Shout out to you, Vicky. Can I borrow someone's URL login if you have already passed and it's not expired? Listen to your videos. You listen to my videos like on here, because I have other videos that are in my course as well. You can pretend you have dementia and I create a new story. Stop it. Shout out to Arizona, and you're from, is it Carl? Is it Carl or Carl, if I said that right? Shout out to Haiti. I think you're probably the first person from Haiti I think I talked to you. So, but what question, I know where y'all are from, but what other questions do you guys have? Questions, comments, or concerns? So here's the thing. Here's what I'm going to tell you. Nurse, is it Nurse Babe, BSN RN? I've borrowed people's stuff before in the past, but nothing holds you more accountable than you investing your own money into something. Just saying. I've done it before where I borrow people's stuff, and the reality of it is that you don't have what's the word I'm looking for? You don't have really anything invested. You really don't have anything invested if somebody's going to let you borrow it. You know what I mean? Because you're like, well, shit, I got it for free. So, like, I can't really find the word for it right now, but y'all are picking up what I'm putting down. So I'm just letting you know. So many people tell me they were just like, I can't afford this. But then when I turn around and I asked them, I was like, I'm not a financial specialist, but let's think about all these trips that you're planning. Let's think about, how much you eat out during the week. Let's think about, those new pair of shoes or that bag that you went to go buy, so you can get that instant shot of dopamine. And then all of a sudden it kind of just goes away, rather than you turn around and you invest a little bit of something into something that is going to help you progress over that line of gratification that you need for yourself, aka getting that license, right? For the 7-day NCLEX review, I pay $7 to join, and after I need to pay something else. So the 7-day NCLEX course, it's $7 to join, and you get it for 7 days. All right. So 7 days, and then after that, it goes into a monthly subscription. And so with the monthly subscription, you have access to the 7-day NCLEX review. You have access to the new generation NCLEX review, all the content videos, as well as the community where I do live lectures, as well as question breakdown like this as well. And you also, you get the chance to get a one-on-one mentorship call. I also do, I'm going to start, it's actually fairly new, but I'm doing Q&As, to where it's live Q&As where I'll bring you up and we can have a conversation. So whatever you have going on, we can try to help break it down for you, or, at least put you on a path to help you do something different. What is your starting pay? It depends. My starting pay as a nurse here in Texas, it was $25 an hour. I made more in the military than I did working as a nurse. So do you think residency programs are worth doing as a new nurse? I do, actually. The one thing I don't like about residency programs is the fact that they try to lock you into a contract, and I don't like that. I don't like that at all. I think one thing I don't like about residency programs is the fact that they try to lock you into a contract, and I don't like that. I don't like that at all. I think residency that, and then I used those things, and I didn't pass. It wasn't until I started investing in myself to really understand that my money, I put the value into this and understanding how these tools work, and then that's when it worked. It says, I'm talking about your NCLEX review, help the paying start. So it starts at $7, and you get to do it for 7 days. After 7 days, it's a monthly subscription of $97. I've been a preceptor for medical corpsmen. That was a great experience. And I love that. I love that you were doing it for corpsmen, because corpsmen kind of teach new nurses how to do things on the floor. But the nurses have the why. And I was a very hard-headed person, and I didn't like nurses, because I was like, how dare they give you a bachelor's and you don't know how to do this? But then now it's just me being very naive, being very egotistical. So I got checked multiple times with my ego when I became a nurse, even before that. So, but one thing I do love is, like, with corpsmen, like, there's no other corpsmen, medics, Air Force techs as well. So it works. Like, I love that you have that experience and you can teach them. What's the most interesting patient you've had diagnosis wise? Kate, I'm really gonna have to sit there and think about that. Samantha said I froze. Am I still frozen, Samantha? Hey, y'all give me thumbs up. If I'm frozen, obviously, if I'm frozen, y'all aren't going to be able to hear this, but y'all give me a thumbs up if I'm still good. No, I'm good? Cool. All right. Kate, I don't know. Like, I've had some people, I had a patient who had, it was a form of VFib. It's kind of like what DeMar had, which was the Buffalo Bills player who ended up having a form of ventricular fibrillation. It's Column core or something like that. So I had a patient that had one of those, and I was like, yeah, it's usually done with like blunt force trauma, like directly to the chest. Anybody ever seen that game of open chest where kids usually, if you're not blocking, they're punching you straight into the chest, and it causes you to have, there you go, core polymate. So that's probably the craziest thing I think I have seen. No, it wasn't core polymate. It was something else. Hold on, let me see. It was something else. Let me see, and I'll tell you. Cardiac arrest. what was, oh, it was, it's comatio cordis. That's what it was. And I had somebody have that, and I was just like, whoa. And it's because they ended up getting like it's blunt force trauma directly to the chest. And if you think about it, during that football game, that's exactly what happened to him. And I was like, how in the hell did this dude end up here, right? And so it's crazy. So that's what I had. It says mine was a patient who kept coding every singular one compression, brought him back, and then I've been there. I worked during the second wave of COVID, so I had so many different things that happened with people. There was a lady who had every comorbidity that you could think of, and we extubated her, and she lived. But you see other people, they didn't make it. So, but appreciate everybody joining. We did NCLEX questions. We do NCLEX questions every Monday, Wednesday, Friday at 5:30. And if you missed it, sorry, I actually did extra questions today. But if you're just joining, my name is Kevin. I go by the Boot Nurse on all social media platforms. By the way, we don't know what the state of TikTok is going to be, so make sure you guys go over there and follow me on Instagram. All those links are in my link tree as well as in my bio for all of your NCLEX needs. I post NCLEX type of questions every other day, as well as some good things to help you guys coaching wise, to help you guys get you through it. Because I've been there. I failed my NCLEX 3 times, y'all. Three times. And let me tell you something. Your patient will never ask you how many times you took your exam, and your job will never ask you how many times you took your exam. I have coached people that have failed upwards up to 11 times, and now they work in, critical care areas. The test doesn't define you. Only you will define how you are. Period. The test sets a standard and a baseline. Now, do you want to fall below that baseline, or do you want to continue to excel? Remember, nursing is a continued lifelong learning. Your skills matter more than your license. Well, I wouldn't say your license, because your license is what governs you to do that. But your skills do matter. The knowledge, you will gain more knowledge as you start to go. I passed my NCLEX. Thank you so much. Starry, that's what I'm talking about. Starry, you're like number 3 or 4 to come in here to tell me that you passed your NCLEX. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everyone that's kind of just hanging out here, about NCLEX, what would it be? And of course, once again, congratulations to you. No, they always ask, where did you buy your license from? I bought it from Florida. I'm just playing. Ashley said, I feel like I chose the wrong nursing school, but I'm too deep into transfer. Why do you say that, Ashley? And by the way, Ashley, let me let you know. A lot of nursing schools just fucking suck. They just suck, because it's just all this information by fire hose, and they're telling you to be a self-learner. If I was to be a self-learner, why would I pay a tuition? I should have just gave my money to fucking YouTube if I was a self-learner. You see what I'm saying? So, the biggest thing about nursing school is just getting through it. It's just getting through it. Trust me, because I feel like my nursing school sucked too. I'll agree. I will throw that out there. My nursing school sucked, right? Because every time I asked a question, well, you're supposed to be a self-learner, and I turn around, I was like, then what do I give this school money for? Why do I give them money if you're telling me to be a self-learner? I should have just gave my fucking money to fucking registered nurse RN. You see what I'm saying? So, you'll get through it though. You'll get through it. It says, listen to Nurse Kevin, Coach Kevin. Hey, Starry, I appreciate that. I appreciate that. I'm glad that worked out for you. I'm glad that these lives and the NCLEX course and everything that you're a part of, I'm glad that worked out for you. Remember, tell your story. Tell your story to everybody, your hardships, because people need to know that. It is constant, disorganized chaos. The instructors are limited in the ways that they can help us. Our teachers are quitting mid-quarter. You want to know why they're quitting? It's because they're not being valued. And then on top of that, people like me that want to go and teach, they don't hire you because they are just like, oh, you're not in the budget. And I'm just like, so you mean to tell me that somebody who has massive amounts of experience, not just me, but other people who have way more experience than me, y'all don't want to hire them to teach these nurses going out there? You see what I'm saying? It's all about the bottom line. And especially when you have these big corporate conglomerates of fucking organizations like HCA or Advent Health or Baptist or whoever, who are buying up these schools and putting them, in conjunction with one another, nursing school directly to that hospital. That's another issue. That's another issue that goes into the aspects of getting people in there because everything is so corporate. And then they're wondering why you can't keep people there. On top of that, they are making all these nurses that do work there do so much more, like the work of like, 2 to 3 instructors are trying to make you do more. Smalling College of Nursing, I don't even know where that's at. But here's the thing, like I said, I heard somebody say, don't be a product of your environment, be a product of your decisions. Galen. Oh, you go to Galen? Galen where, Ashley? Galen where? Because I live in San Antonio and there's a Galen here. But I know there's Galen. I know there's Galen all over the place. And if I'm correct, Louisville, Kentucky. Okay. So there's Galens everywhere, and I'm pretty sure Galen is one of those that's owned by, a hotel, a Charlie, an Alpha type of person. Galen in Richmond, Virginia. Okay, there's a Galen here in San Antonio. I know there's a Galen in Houston. I think there's a Galen in Dallas, owned by HCA. Yep, there it is, right there. You said Lala Range Rover. That's it. That's it. All I got to tell y'all is that when you guys start seeing these issues happen, follow the money, because the money will show you why the things are the way that they are. There's a reason why that organization specifically they made like $9 billion like last year. There's a reason. As well as the CEO, made like an annual revenue, or his salary was like 30 million. I'm just saying. They hassle you all the time to get you to stay with them. Yeah, they do. You mean the 7-day, I'm assuming? Is the 7-day course enough to pass NCLEX? Yes, it is. I don't know if you were in here earlier, but Donnie, who was just in here, used my 7-day course and passed in 86 questions. I think that's what he said. So it works. But the thing about it is, like, there are many tools that are out here. If I give you a screwdriver and you try to use it as a hammer, obviously you are not using the tool correctly. So there are tons of other things that are out there that are just the same way. So what I will tell you is that it works. It 100% works because people have used it. Yeah, it works. Hi, everyone. Hey, Kevin. Sorry, I've been missing. I've been working a lot. Anastasia, girl, you ain't got to explain nothing to me. Live your life. Do you, boo. But I appreciate you stopping in. It's all good. Still getting your learn on. I know you're doing your thing. So it's all good. No problem. Hey, I'm here. Hey, by the way, y'all, I'm not a scam and I'm not spam. Do I look like Dr. Luther trying to tell you to buy some shit? Like, if y'all know what I'm talking about, y'all know what I'm talking about, right? So, hey, I'm here. As I said, if you guys got any questions, ask me your questions right now. Like I said, if you guys are just now joining, I did NCLEX questions. Joyce, I see you in there. I did NCLEX questions. We started at 5:30 Central Standard Time in Texas, right? Because obviously that's the only thing that matters, right? Stacy, welcome. And we do, like I said, we do NCLEX questions Monday, Wednesday, Friday at 5:30. And now I'm just doing essentially a Q&A. Like, what question do you guys have? You guys talk about NCLEX, getting into nursing school, so on and so forth. Is the 7-day NCLEX enough to pass? I answered your question already, and the answer was yes. Hello, my daughter. I told Kevin hello. So your daughter, I told Kevin I was your okay, I got you. So your daughter's in here, and you were just like, I told him that, hey, if your mom precepted you, hey, that means she got you right. With all that years of nursing knowledge, somebody got you right. I'm telling you right now, a preceptor right now, a preceptor will make or break a new nurse, period. And when you go through so many preceptors, y'all, I miscounted. I went through 9 preceptors. And one of the preceptors that I really wanted, they were just like, nah, like, we have to put you on nights. And I'm just like, but this person is showing me what to do. And they were just like, no, you got hired for nights. And I'm like, what the fuck? So, a preceptor will make or break you. And if it wasn't for that one preceptor that I was just like, I need to be back around her, I would have left my ICU a long time ago. I would have left it a long time ago. Hey, y'all got me to 29,000 likes. Hey, give me to 30. Hey, give me to 30 before we end the stream. I'm probably going to end it like in the next 10 minutes anyway. So, well, like I said, what other questions do you guys have? Like I said, my name's Kevin. I'm an NCLEX coach. I failed my NCLEX 3 times, so it only makes sense for me to come out here and teach you guys all of the wrong things to not do. Teach you guys all the things that I did wrong so I can get you guys right. All right. I failed first time 75 questions, second time 265 questions, if any of y'all can believe that. And then the third time it was 106 questions. I was all in my feelings trying to figure out what I was doing wrong. I eventually got a mentor. He pointed out where I had, issues at, and then I grew from there, and I passed it during COVID at 60 questions. All right. So I'm just letting y'all know that I have essentially been around the block, and I know I know how NCLEX is going to ask questions. I could take an NCLEX exam right now and I couldn't, it's weird. I couldn't fail it even if I wanted to, because I understand it so much and I've seen it so much, if that makes sense. So, like I said, what other questions do you guys have before we get off here? What other questions do you guys have when it revolves around being a nurse, getting into nursing school, doing your prerequisites, bridge programs, all kinds of stuff? What do we got? There was something I was going to play, like an outro song, and this essentially was going to be for Blue's Clues. Mostly because it's I gotta go. But you know. You're like, all right, team, let's roll 30,000 on the way. I love it. Hey, look at that. 30.2. Best way to improve your critical thinking, practice. In order for you to improve your critical thinking, first you need to understand your content. If you don't understand your content, you're not going to be able to critically think. So if I don't understand how hemodynamics works, so we talk about how the heart works. If I don't understand how the heart works, how am I going to understand the scenario that's going to be given to me that involves the heart? Does that make sense? So with that being said, it starts with your content. The content is the foundation. You have to acquire the content. And if you don't have the content, you have to go find it. You have to find it somewhere. It can be in a program. Like my program, I go over content, tons of it, right? And so then after that, you have to use the content that you acquired and you have to apply it to your NCLEX style question. Now, based off of what your question is asking you, you need to understand what is more important, right? When we talk about hemodynamics, right? But then they want to know what you need to do as a nurse that is safe, like the safe standards of care. Right? That's what we call a clinical judgment. You have to make a safe clinical judgment. All right. And then after you do that, this is when you're practicing, you go back, and if you don't understand it, regardless if you understand it or not, you have to read and review your rationales. You have to, right? You'll hear some people say, oh, the NCLEX was easy for me. Well, I didn't ask you if it was fucking easy. You are an anomaly. You know what I'm saying? The NCLEX had a pass rate last year of 79%. This year, or the year of 2023, I think it went up to 88%. But still, if it's so easy for you, or if it's so easy for everybody, it would have a 100% pass rate. There you go, Kevin. So you have a good team. I love it. I appreciate y'all. 31,000 likes. I appreciate that. So in order for you to get better at your critical thinking, you have to put yourself in that space of doing your content, answering your questions, as well as reading your rationales, as well as when you go to clinicals, asking your questions to your preceptor. Say, hey, I'm really trying to do better with my critical thinking. I really want to understand the pathophysiology of when this disease process happens. What are all these things that are happening internally to my patient? And when some things come up, what are the most important things that I need to know? That's what clinicals is for, is to take all of your book knowledge, right, and put it in real life in front of your face. That way you know how to take it step by step. How do you study the content with a study partner? So in reality, for me, you can go through a lecture, and the best way to learn is to teach others, right? So as you're teaching others, that's how, if you're going to use a study partner, that's what I would recommend, is you teach each other, about, the important things from certain areas of the content, right? So pharmacology, we'll start with cardiovascular meds. What are the most important cardiovascular meds that you need to know? So we can go, hey, let's talk about our ARBs. All right, here's the important things you need to know about them. Let's talk about DIG. Let's talk about ACE inhibitors. Let's talk about calcium channel blockers. Let's talk about those, right? So you find those subjects that are important that the NCLEX would ask you, and you pick out the key things that you would need to know. And then you teach each other that, right? So that's my recommendation for you. I usually tell people you don't really need to study in a study group because you're not going to be taking the exam together. You're going to be taking it, solo dolo. All right. Ashley, you are very welcome. I hope that made sense. I feel like I was kind of going around in circles, but I hope that made sense. And Joyce, hopefully that made sense as well. Because, that's how you study with a study partner. You teach one another. So if there's a section, like I said, with pharmacology that you don't know, the best way for you to know is for you to go tackle it, find the information, and then teach one another about it. It doesn't matter if you put it on a PowerPoint. It doesn't matter if you do it on flashcards. However you can get that knowledge across. Like, oh, okay, that makes sense. Oh, okay, that makes sense. That aha moment that people get. All right. Hey, is it Chela? Jamie? Hello, welcome. Hey, if you guys are just now joining, we did NCLEX questions. We do NCLEX questions every Monday, Wednesday, Friday at 5:30. So make sure you guys give me a follow, a like, as well as you guys turn that notification on. And also, go check me out on everything else I have going on. We don't know the state of what's going to happen to TikTok, here in the next couple of weeks, if they're going to shut it down or whatever. So make sure you guys go over there and follow me on Instagram as well as on YouTube, because I'm very active on both of those as well. So make sure you guys go over there and check me out so you guys can keep getting this NCLEX knowledge. And of course, if you're still with me, I appreciate you guys rocking. You guys got me to 31,000 likes. What other questions do you guys have? I'm going to hang out for about another 4-ish minutes. And then, we'll call it a night. We'll call it a night. What are we thinking? By the way, we're in the full, now we're in mid-March. So now we are in full swing of NCLEX, right? Over the next couple of months, NCLEX is about to be super, super heavy. All right. So I'm going to be putting on, some like live webinars, some e-classes talking about NCLEX, as well as some stuff that I'm going to be doing over inside of the 7-day NCLEX course. Make sure you guys are following my man DP in the building. I see you over there, big dog. Sarah, thanks for joining. Thank you for being here. Hey, so if you guys are new here, my name's Kevin. I am a nurse. I've been a nurse for almost 4 years. I've worked ICU, OR, and PACU. I'm also an NCLEX coach. Myself, as well as Nurse Amber or Nurse Glamber. She's an NCLEX strategist over there. She can we both definitely are out here in these NCLEX TikTok streets trying to help y'all, be better. As well as some other folks I can, give some shout outs to. You got Nurse Larissa, who's over there showing y'all how to make this money out here with that nursing paycheck. You got a blessed RN, Nurse CC, over there helping y'all doing that dosage calculation. Look, she out there doing God's work. You know what I'm saying? And you got Nurse Sugar who's out there who does NCLEX stuff and NCLEX questions. Who else is out there? Got a whole bunch of folks that are out there. So make sure you guys go over there and check those people out. Okay. All right. If you guys don't got any other questions, I'm going to go ahead and I'm going to wrap this live up. And here is a, not a shameless plug because I'm never ashamed of all the things that I have going on. Make sure you guys go over there and check the links out in my bio. If you're looking for one-on-one coaching, I do that as well, to where it's exactly like this, but it's not on TikTok and I don't got a bunch of people leaving comments or just ignoring me. So we can do one-on-ones, talk about what you need help on, and work with me for 30 days and let's get you that license. Also, the 7-day NCLEX course. You can join the 7-day NCLEX course for $7. You can join the 7-day NCLEX course for $7, y'all. That's cheaper than what some of y'all spend at Starbucks. I'm just letting y'all know. So y'all can check that out as well. I have an ebook that's over there you can check out. And of course, I have a free download that's over there, 42 pages that you guys can look at and have all to yourself to help you conquer the NCLEX. Hey, the NCLEX is right around the corner. The season's about to be high. So I want everybody to be ready for it. And then lastly, before I leave, be kind to yourself. All right. Let me tell you something right now. Everybody always tells me, oh, I became a nurse or I wanted to strive to do this for them. And I was like, no, you don't do it for them. You do it for you. You do it for you. And the other people that are important in your life happen to benefit from that. I'm telling you, your kids don't give a shit if you became a nurse. They don't care. That's self-gratification for you. Because guess what? Your kids are going to benefit from the knowledge as well as from the income that is going to steadily grow as you become a nurse. So be kind to yourself. Take care of you. You only got one you, because if you can't take care of you, you can't take care of nobody else. All right. So once again, I appreciate everybody jumping in. I know TikTok, put me in timeout today, and I'm a little sad about that, but whatever. But anyways, I hope everybody has a really good, safe weekend. I hope everybody, keeps doing their studying. But like I said, have a good, safe weekend, and I will see everybody on Monday. Bye.